Here we go. I'm always happy when I see the numbers and I see that we're live and I see the internet going well. And I'm grateful to the internet. Talk about
Yes.
grace. My name is Dr. Tovah Goldfine. This is TMS Roundtable. This is, I think, number 266
Awesome.
broadcast that we've been streaming live. And this is going on our 5th year. And I couldn't be more blessed, happier to meet incredible people like you, to be rubbing shoulders with
Yeah.
incredible healing people like Treva Nading. Did I say
Treva.
your name right?
Treva. Yeah.
Treva. It's
Yeah.
such a beautiful name. I'm
Thank
going
you.
to put it up in a minute. I've never heard it before.
Thank
And
you.
it's a beautiful, beautiful name. And you're a beautiful, beautiful woman and a beautiful, beautiful soul. And our listeners will hear why once you start talking. So this week on TMS Roundtable Recovery, we're talking about a difficult condition. And I know it's difficult. And I know that most doctors say it's permanent. And I've
Mhm.
met other people that have healed. I myself have helped people with a combination of chiropractic treatment and some of the mind body work because things are getting pinched up, things are getting locked, the nerves are getting compressed. The question is, what's doing it? What's the cause? How did it start? Why this particular neck? Why this particular face? What are the circumstances of the individual? And so when I met Treva,
Treva. Yeah.
beautiful.
Thank you.
It was just recently. I saw you on one of the Facebook pages, the TMS pages, and I saw your story, and I reached out, and you were so excited to meet me. And then I had a Zoom with you, and we were talking for hours
I
about
know.
your journey. Now,
Mhm.
listen, your journey is some hell of a journey. So let's
Yeah.
share with the audience. Okay. So start from the beginning. You had just mentioned you had a few surgeries, you had a few, difficult things going on. And then tell us when you got the trigeminal neuralgia, and then we'll talk a little bit about, what left your body so vulnerable and so susceptible to develop an autoimmune disease like that. So go ahead,
Yeah.
Treva, and thank you so much for joining us.
Oh, thank you. It's good to be here. I'm
Yeah.
hoping I can reach a lot of people who have trigeminal neuralgia. I had type 1 and type 2 trigeminal neuralgia. I'm not sure, if people in the audience are aware of both types. There's two types. One is like the constant burning, in your face and tingling and burning, and it never goes away. And then the type 1 is the type that there are certain triggers like the wind on your face or the light shining on you or a sudden loud noise or something, and it causes severe, like a fire poker stabbing you in the eye or an ice pick in the eye with a jumper cable attached to it. It was excruciating pain. And I, unfortunately, I had both. They were both on the right side. It started, I was diagnosed with, I had a spinal fluid leak, a cerebral spinal fluid leak, a CSF leak. Was misdiagnosed with allergies for several years, fortunately, and it would close up. This leak would close up and then it would open up again. But unfortunately, I got meningitis because it was an opening to, the lining to my brain. And I got meningitis and got over that. But within 6 months, I had it again. And the hospitalist knew something was going on. It wasn't normal. That doesn't happen. So I was referred to a neurologist, and the neurologist did CT scans and found there was a leak, a spinal fluid leak, and it was pretty obvious because I had clear liquid running out my nose. Very a lot. Just go like this, and
Sure,
it
that
would.
was scary. Yeah, yeah.
So so they scheduled surgery because I had to have surgery to try to close the leak, and I had the surgery. It seemed to be successful, but then a complication happened while I was in the hospital, and it opened up. while I was in ICU again. Had to go back within a week and have a second surgery, which was a craniotomy where, they cut you from here to here, drill a hole in your brain, in your head, skull, open it up. And, it's very invasive, very invasive. But they tried to repair it again. And it wasn't as bad as it was, but I could tell I still had a leak. But when I would go for CT scans, it didn't show up on the CT scans. Wow. But when I woke up in the mornings and I would get up, the fluid would run out my nose the same as it did before. But it didn't do it all the time. So, and I had multiple CT scans to try to find it, didn't find it. I did it was about 4.5 years later, I contracted meningitis again. It was inevitable because I knew there was still an opening there. So it happened. And that time, the neurologist that I saw before referred me to go to OU Medical Center, because I live in Oklahoma. And these surgeries that I had previously were in Tulsa. And they said they had done all they could in Tulsa for me, that I needed to go to OU because they had a new method of surgery where they didn't actually have to go in that way. They could go in through your sinuses and do it through your nose, So they did that, and it seemed to do okay until they removed the packing and, the tubes out of my nose, and it ran again. Mm-hmm. Well, they sent me home and I got meningitis again. So that's the 4th time I had meningitis. I went back to the hospital and they did surgery again. It was 1 month later after the 3rd surgery. They did the 4th surgery. And during that surgery is when they tweaked the trigeminal nerve.
Right.
It took them a long time to find the leak that time because they thought they found it. And like the doctor said, like if you're in a house and you're finding a leak in the ceiling and you think it's on this side and you end up it's on the other side, he said it was completely in the opposite place that they thought it was. But they thought sure that they got it fixed that time. But they did have to do a lot of looking and a lot of moving around, to find it,
So did they tell you they affected your nerve?
After I went back for one of the follow-up surgeries after, a few weeks, after the surgery and after they removed the packing the second time. And then I went back for another follow-up. I told them, I said, I've got all this tingling and my mouth feels like it's like when your arm's waking up. I had all these pins and needles all over my face and my lip. And I felt like my lip was this big, like when you're at the dentist's office and, you've had a shot of Novocaine and it's trying to wake up. And the neurologist said I might have tweaked your trigeminal nerve when I was in there.
Okay, well, at least he's fessed up for that. So
yeah.
Did he give you some treatment? Did he tell you it was going to heal? Did he tell you?
He said he'd never had that happen before, he said. So he didn't really know if it would, he said it'll probably, get better, but if it doesn't, you'll probably need to go see another doctor, not him, but he would refer me to someone else to go see about it. And it didn't get better. So I called him. It was actually getting worse. And so I called him and they referred me to a facial specialist. And I can't remember his exact title, but a different doctor. And he's the one that diagnosed me with trigeminal neuralgia. And he told me that there was no cure and that it would get worse over time. It would just continue to get worse. And he referred me to pain management. And, so I went to a pain management doctor and they had me take, gabapentin and, different medications. He prescribed me gabapentin and a couple of other medications, and it didn't work. It kept getting worse and worse. And so I went to the pain management, and I was on everything from fentanyl to Belbuca. I was on ketamine, I was on so many medications. It was like 5 years of a blur where I would just, and everything I read, I of course had to go research trigeminal neuralgia myself, and so it started telling, you know, everything I researched told me that it wasn't going to get better, and all the different things it was going to hurt and things I couldn't do. And I did join some Facebook groups, some support groups, and everything that I read on those, primarily everything I read on there was people trying to, I don't know, they were telling you like how horrible their life was, how this doesn't get better, and this is a suicide disease because 50% of the people who get diagnosed kill themselves within the first 2 years of diagnosis. And a lot of people from the groups, we did have a lot of people in those groups that did just, choose that direction,
So
and
this time, those 5 years with all these medications, were you getting some relief? Were you just
no,
thinking, I'm
no,
just I'm just a sitting duck. I just got nicked in my pterygomal nerve, and I'm a victim of the medical system, and they got rid of my meningitis and the leak, but now I'm stuck with this. Like, what were you thinking?
I, I was just thinking, I kept thinking, what can I do? There's got to be some way to fix this. There's got to be some way. So that's why I kept reading about it, and I started listening to audiobooks about vibrational healing and different modes of healing. And, because I thought there's got to be something out there besides all this medicine that just, every, 4 hours, take this medicine and go back to bed, get up and, take more medicine, go back to bed, and just, I was a zombie. I had no life. I had to quit my job. I was a CPA. I'd worked for, 30 years, over 30 years, trying, very, very active person, and to go from being, a full-time, traveling, I traveled a lot, with my job. I traveled international,
Also, I mean, you healed, many surgeries, 4 or 5
yeah.
bouts of meningitis, spinal leaks. Like you had come out of that and you were like, wow, my body's strong, my body's capable. And then this happened and you probably just felt like, but
It was
I
a
mean,
total, yeah.
part of what was going on was you just kept exploring. You didn't give up.
Right, right. I wasn't going to give up. I'm not a, I guess I've always had a real positive attitude about everything. And so I couldn't accept that was all there was.
Right. You
I
weren't going
didn't
to
accept
negotiate.
that.
You weren't willing. You're not going to negotiate with this with
No.
the medical community. You were like, my body is saying something. And so tell us more. So you're not working, not living your life.
Right.
You're in a lot of pain. The medicine's not working. So what brought you to this space of understanding the neurology of pain, which is part of this neuroplastic work that I do? What was it? What
Well,
happened?
and part of my, research and journey through this was listening to audiobooks. And some of the audiobooks, had mentioned Dr. Sarno a few times, but I'd never read any of books because they mentioned healing back pain. Well, back pain wasn't my problem at the time. I'd had back pain in the past, but that wasn't what was bothering me right now.
Right.
That wasn't my problem. But I also had started watching, I was on Facebook and I was watching YouTube videos. And I was on Facebook and there was a girl, and I looked up her name. I looked up the message that I had from her on Facebook. Her name was Katie Jackson. And I think she was from the UK. And she's the first one that suggested, I think it was the Mind Body Prescription from Dr. Sarno. And so I went and got that audiobook. I mean, I couldn't read books. I used to read a lot, but I couldn't read because I couldn't wear my glasses, because when my glasses touched my face right here, it hurt too bad. I couldn't wear them.
Wow.
So I started listening to audiobooks. Well, I listened to that audiobook and I thought, well, that's pretty good, So I went and got, his other audiobooks. But at that time I was still on so much medication that I didn't feel like I was comprehending everything, but I kept listening, and kept getting another one and getting another one. And then I also listened to a couple of Stephen Ozanich's books, because it had Dr. Sarno's name, it came up when I did my search for him. And then I saw a video, a YouTube. I was on YouTube, and I had looked in Steve Ozanich's page, the Healing Wall of Victory, or I can't remember the exact how it is, but it's his.
Well, his book was called The Big Pain Deception.
Yeah, right. And I watched some of his YouTube videos, and so I think the algorithm picked up, and it was showing me other YouTube videos, by him, or similar to that, and that Dan Buglio, is that his name? Dan Buglio. He had a girl on, and she had trigeminal neuralgia. She had atypical trigeminal neuralgia, and she had healed from it. And I watched that, and when I watched that, it was like, oh my gosh. I got so excited because I thought maybe this will really work. So I went back and listened to the audiobooks again, and I had missed it the first time, or first maybe 2 times that I had listened to, I believe it's a Mind Body Prescription from Dr. Sarno. He actually mentioned trigeminal neuralgia and different neuralgias in there.
It's an absolute condition.
And I had also been diagnosed with fibromyalgia, along with the trigeminal neuralgia, because they said because I was so tense and so,
of course,
so tied up in it. So when I saw that video, that is what really got me. I was more hopeful then than I had ever been since I'd been diagnosed.
Wow.
And so I started listening again, and I decided I'm getting off this medication.
Wow.
I'm stopping my medication. I don't need this. This is just making me stupid, is what I thought. It's just making me stupid. I can't remember anything that I've listened to. I go back and listen to it again. I didn't hear it the first 4 times I listened to that book, so I just weaned myself off all the medications.
Wow.
And started listening to the audiobooks again. And I tell you what, it was like a new.
And so this is the answer to your question. So Barty asked a question. He said he's using somatic tracking, which is a way of calming the brain down and talking to the brain as if you're with the pain of the trigeminal nerve and you're kind of focused on it, but calming the brain down as opposed to reacting. You're more responding. So he's doing that. What else can he do? And so now you're going to share what else you did to literally be your own medicine.
Right. One of the things that they suggested in one of the books was journaling, which I had never done. And so I went and what I did was I went through and made a list of important dates or things that affected my life, events in my life that made an impact or a change in my life. And somehow, whether it was good or bad, positive or negative, whatever, if it made an impact on my life, I did that. I just made a list of them. And then I would go pick one, not in any particular order. I would go pick one and I would just journal about it. And I'd never journaled in my life. I had no idea if it would work or not, but I was willing to try anything. So I went and I started journaling, and it seemed like that was the key that helped me understand that it was the emotions, that I had, it was unconscious emotions that were really triggering all of my pain, and it was causing. Let me back up. I'm getting ahead of myself, I think. But I realized that my pain was caused by my mind trying to protect me from these emotions.
Wow.
You have the emotions are there, but all I had to do was recognize that those emotions are there, and that my body, my mind is trying to protect me by keeping me focused on my body.
Well, that's almost like word for word, Dr. Sarno. And it's funny because we don't say it so much like that. We say that the emotions are suppressed, repressed, and the brain is perceiving a threat because there's a conflict, and the brain is always checking in.
Yeah.
What's going on? It's like a radar. It's like a a constant radar, constant fire alarm, looking, and so it's checking and it's sensing some conflict. It's sensing. It's connected to the
Right.
subconscious through neural circuits. So and a lot of these emotions, pain, anger, fear, sadness, guilt, they're processed in the amygdala in the same place where chronic pain is processed. Now, again, chronic pain is different than acute pain. So, chronic pain is processed in the amygdala. I'm giving a layman's term.
Yeah.
And the brain will perceive this threat. And all it is these emotions. And chronic pain is an emotion as well. It's been studied. So you're
Right.
simply saying it in those exact words. Say it again for the listeners to listen, because this is a very key. And I know it sounds a little woo-woo, but this
Yeah.
is the science. This is the science, and this is the key to opening up.
Yeah.
Again,
Your
please.
mind is trying to protect you from the emotions that your mind perceives are too dangerous or too painful for you to recognize. And so it causes pain in your body, a physical pain, to keep your mind off of, to distract you. It's a
Yeah,
protective mechanism
right,
to distract you.
right, right.
And it does. The pain is horrible. The pain is real. Nobody I've had people, that I've tried to explain this to say, that it's not in my head. It's not in my head. This pain is real. This hurts. And I'm like, I know that's real. It's very real. But the source of the pain is not,
Dr.
you're
Schrubiner's words,
not
Dr.
this.
Schrubiner's words, Dr. Howard Schrubiner's words are all pain is real,
Right.
but it's all the pain is processed in your brain. And chronic pain is processed in your brain in a different place than acute pain. And chronic pain is learned pain.
Right.
Okay. So let's just say, for example, your trigeminal nerve got nicked in the surgery and the nerve was exposed.
Mm-hmm.
And so you begin to have pain. But at some point, the nerve heals, probably with some scar tissue, which
Right.
is not painful. There's no
Right.
nerve in scar tissue, and you still continue to have pain. So your brain has learned pain. It wasn't acute 2, 3, 4, 5 years later. It was more
Right.
chronic, and your body was still in this protective mode, protecting you. It's as if it knew it got like. It's funny. It's interesting the way that your trigeminal nerve started. It was a real injury. It was a real
Right.
surgery mistake, and yet you still are coming here and saying you have recovered. And I
Right.
want to say to the listeners, Treva, you are special. You're an incredibly special soul, and so are you people in the listening audience, and so are the people all over with chronic pain. But you made a decision. See,
Yeah.
that's the difference. And we all
Yeah.
have this choice. And I want people to know they have choices. You made a decision and said, I am not going to be a victim of the medical model. And great, the medical model is wonderful. And there are people who get their nerve nicked and feel better, and they're never even going to come past me or you.
Right.
You were a victim of the medical model for a certain point, and you woke up and said, I'm not going to continue, okay, to negotiate with my body. I'm going to tell my body who's in
Right.
control here. And that's what makes you special. And that's what makes all of you special out there, that you can do this. And this is the empowerment that the doctors I work with do. I mean, we really want to give you the power and the self-healing. And I know Scotty from Canada, who's a coach and also went through horrible back pain, he's going to be my guest next week, will say the same thing. You are the conductor. You are the the pilot of your plane.
Yeah. And a lot of I love all my doctors. I mean, even the doctor that nicked my brain, he
That's
I mean, he
amazing.
was wonderful.
Wow.
You know, they're wonderful doctors, but unfortunately, the medical field is not trained in TMS. They're not trained in mind body issues, and so they don't even go there. They see something on an x-ray, or they see something, you know, they say, okay, this is the way it is, this is how we treat that. And I really, really wish that more doctors would, you know, be trained in trigeminal I mean, that, you know, that where people have trigeminal neuralgia would
Yeah.
be trained in TMS and know that there could be something else going on here, not just a nerve, you know, because like you said, they heal. Your body
Nerves
heals.
heal.
Our bodies are
Nerves heal.
fantastic, you know, our
Yeah.
bodies can heal, you know, but just to believe your doctors that this is all you have to live for, you know, this is all you have to just manage your pain. Who wants to manage pain? That's what I always said. Why would I want to manage the pain? I want it gone.
Yeah.
I
Yeah.
want it gone. I don't want to manage it.
So tell us more about so you began to journal, which is so
Yeah.
powerful and so neurological and such an incredible insight and tool and resource for us. And it's not the easiest thing to do to visit
No.
yourself and write, but it is
Yeah.
so effective. Tell us more about that and what else you did to calm your brain down.
Okay. I, well, besides, I mean, it was tough going through and journaling this stuff. It really was. It was very emotional. It was very, very tough doing that, you know, but it was worth it, you know, and one of the other things that I like to do, and I still do it, is I listen to Dr. Sarno's. I have it bookmarked in my audiobook, his daily reminders of the 12 things, you know, and that really helps. I mean, if
Great,
anyone's listened
great,
to his, you know, his book,
great.
Healing Back Pain, you know, it's just reminders to remind you that, you know, the pain is not caused by a structural, you know, abnormality of any kind, you know, that it's caused from your emotions and your, you know,
So
your
you learned a language. You studied it. You read the 12 reminders. You
right.
like affirmed. You had affirmations that this is pain that's coming from my nervous system, and it wasn't like you changed who you were. Tell us more.
No, no,
What you
no,
did.
you
Tell
do.
us more.
I'm the typical, what Dr. Sarno says, a TMS patient. I mean, I've always been a perfectionist. I've always been a high achiever. I've always, you know, wanted to do good, you know, and I mean, that seems to be the personality, you know, that can get TMS. You know, maybe it, you know, there's probably other personalities that do too, but he made it clear in his books, you don't have to change who you are. You know,
Oh,
you don't have to change your personality. You know, it's just recognizing
good.
that those emotions are there and that the emotions are what's causing the pain. You know, that was
Yeah.
the biggest thing for me. And I battled, you know, with the fear that, you know, it's not bad now. You know, the fear is not there now like it was, but for the first,
Mhm.
I mean, it's probably about a month after I actually got off all the medication, read all the books again, you know, and stuff. My face pain was gone. I mean, I still
Wow.
have numbness, you know, in my
Mhm.
face. You know, I still have
Mhm.
numbness, but I hadn't been able to chew on my right side for 5 years.
Wow.
You know, I started chewing on my right side again. You
Wow.
know,
Amazing.
I mean, there's so many things. I can go out in the wind. I can go out in the sun. You know, my
Wow.
dog
Wow.
can bark. You know, I can hear noises, you know, that.
Yeah.
But I did battle with symptom imperative as well. You know, that,
Explain
which
what
is
that
something
is.
for
Yeah.
people to know, you know, once your brain's not going to give up without a fight. That's what, once
Well,
it's
because
trying
it's
to protect,
protecting you. Its
it
job is to
thinks,
protect you.
right,
And look how
right,
your brain learned after all those surgeries and all those different things in the hospital. Your brain was on high alert.
right,
High
right,
alert.
right,
So
right.
did you
And
do any kind of meditation or did you do any kind of somatic
I
tracking? Did you know about behavior processing therapy at that point? Like, did you see a therapist? Did you talk to any coach?
No, I didn't. I did listen to some guided meditations. I've done guided meditations. Just um, I did that to relax myself. To try to relax
Yeah. Yeah.
a lot. You know,
Wow.
and and to get to sleep a lot when I would be in
Mhm.
pain. I would listen to guided meditations, but I didn't go through any therapy other than just listening to the books over and over again and telling myself I can do this. This is
Quite
something that's
amazing. You
doable. I
really
can do
are.
this.
You really are a kind of a book cure in a way.
Yeah,
You
right.
really, really are. And so, tell us, do you feel that maybe you grew up and you might have had a health anxiety, or you might have had various things going on as a child that led you to not only have the leaks in your spinal fluid, but you also developed these characteristics to be very strong, to be very much surviving and taking care of things and making decisions. And maybe your childhood left you with this kind of, you were telling me that you had some things going on as a child, and maybe that led to this sort of compromised immune system in the beginning, even though it was your nerve that got nicked, but you had this
Yeah, I had
resilience. You had
yeah,
this
growing up
resilience.
I had stomach issues growing up. And in my teens and 20s, I had a lot of urinary tract infections that were so severe to the point that I had CT scans twice on my kidneys because the doctors just knew there had to be something wrong with my kidneys, and
Wow.
there was nothing wrong with my kidneys. But it was like that would they and once they said there's nothing wrong with your kidneys, everything's okay. I no longer had urinary tract infections. Okay,
Wow.
so then I started getting endometriosis, and I had gastroenteritis,
Mhm.
when I was going to
So what were you thinking? So
college.
were you fearful? Were you feeling angry at someone? Were you worrying?
No,
Like,
It
what
was
was
it was
going on?
stressful times in my life, just different things that happened during my life. Like when I was going to college, I got gastroenteritis. Having, I had a lot of stressful issues, when I
Mhm.
was a single mom going to
Mhm.
college,
Mhm.
and that was very stressful,
Mhm.
getting ready to go to summer
Mhm.
school, and I got gastroenteritis so bad I was hospitalized because I was dehydrated. They couldn't find
Wow.
my blood pressure.
Wow.
My blood pressure was so low they couldn't find it.
Yeah, and what I want the listeners to hear is, we can be stressed. We can have enormous, I mean, I've just been through, a year of, being living in a country where there was war, and I can't even explain the level of fear and stress and sadness and grief and worry. And yet, I didn't have chronic pain. I had a lot of emotions and I expressed them all the time. And I um, wrote in my journal and I prayed more. And I saw that, we can live with enormous stress and not have it play out in our body. We're
Yeah,
capable. We're human beings and we're capable. We just have to have a sense of what I'm feeling, how I'm expressing it. Am I expressing it healthy? Do I have outlets? Am I exercising? Am I praying? Do I have God in
right,
my life? Am I meditating? And I think this is the pendulum swinging and not being stuck.
right,
When things get stuck, we get sick. And I
right,
think that most people will see that there's an event in their life or a series of events, and we get triggered, and then our fight and flight just doesn't calm down. And this is what I think you
right,
were, it looks like in your history, Treva, that you were able to really bring down your sympathetic nervous system into rest and digest, and you were able to calm yourself, and then this
right,
thing happened after the surgery, and you were like questioning in a different way. And then 5 years later, you were like, I'm going to bring calm to my body. And you did. And I know it sounds simplistic to our listeners, but it is about calming the nervous system.
Right, right. And I do want people to understand that, they may not be able to read the books and heal like I did. I was very, very consistent and persistent, and didn't give up by listening to the books once or listening to them twice, and I listened to all of them. And I watched YouTube channels a lot, and, the Healing Wall of Victory. And, I did a lot of that, in order to get where I got. But, when now, that I'm healed, and that, I've met people, like yourself, that there is help out there for people to learn how to do this and to be coached through it, and not have to, just be proactive as I was to do it on my own, and I hope that people realize that there's help out there, and that they find that help if they aren't, able to, or persistent enough, personality like I was, to just keep on doing it by myself.
Yes, and there's tons
And
of free resources. There's tons of free
right,
resources. You can always email me. I'm always sending free resources. I meet people for consultations, and there's a doctor in everybody, and I think that's what you found, the doctor in you. And
oh, I want so bad to help people. And
wow,
I feel like, a few times I've got slapped down, on, trying to go to some of these support groups and telling people, no, you don't have to be in pain, and I'd give them a link, to one of, like, Dan Buglio's, video or something, and say, watch this, listen to this, you can heal, I've been healed. And they're like, well, you don't understand my pain, like I hadn't been there, and they think my pain, they'd say my pain is real, and they'd say, I don't want to be part of a cult, or something like that. And I was like, oh my gosh, I just want to help. I'm just trying to help you.
It's about education, and this is backed up by science. This is backed up by science.
Right.
I mean, this is really, look, there are real conditions that are structural, organic, that may not fit the mold. But Treva, I have seen everything heal. I mean, in my 40 years of practice and my 5 years of being on the round table, I have witnessed so much healing that I have to also be one of these, like, like screaming on the mountain, you can do this, because there are people that are doing it, and you are no different. I am no different. We have this condition called being human, and we have a brain that's a lizard brain, and his job is to protect us. And sometimes the brain makes a mistake, and does the opposite. I mean, pain, it's counterintuitive to say that chronic pain is in your brain. It's like, no, pain means something's wrong. But this kind of pain, and what you're experiencing, and what most autoimmune conditions and most chronic pain is, it's neuroplastic pain. It's coming from the brain, and it can be healed through the brain. And with some of these methods, meditation, journaling, knowledge, persistence, repetition, exercise. Tell us, did you start exercising and moving and getting yourself active?
I'm working on being more active. I used to be, I wore out 3 Nordic tracks in my lifetime because I was so convinced that there was something wrong with my back, that if I didn't exercise, my back would go out.
Oh no.
And so if I didn't exercise, my back would go out. That's how the brain works.
Yeah, well, that's your perfectionist, like, determined brain, and you channeled it. And people here listening, I am sure that you're smart and sensitive, and also have a drive. So now channel that to serve you. That's what you did.
Right.
But I'm glad you were at those machines.
Yeah. And I'm after it's been 7.5 years, since I started this struggle, of, since my meningitis and my surgeries, so I've been so inactive during that time. It's just taken me time to get my strength back, get it built back up, but I'm getting there. I'm doing a lot better, and I'm hoping.
Important. We call it fearless movement, because it, first of all, it's blood and oxygen, which is such a incredible, gas for our body, blood and oxygen, and movement. And the brain also needs to see that you're okay. We need to teach the brain. Like, we all think the brain's
Right.
controlling us, and it's really not. We really can train the brain, or one of the doctors in Australia says, tame the beast.
Yes, yes.
Tame the
And you know,
beast.
the brain, the thing that people need to realize is your brain is smart. Your brain
Smart.
is so smart that it will pick something that is a structural abnormality, like a little arthritis in your back or in your neck or something, and it'll cause that oxygen. What is it? Ischemia,
Yeah, yeah.
lack of oxygen, oxygen
Deprivation.
deprivation, and
Yeah.
it'll make that
Yeah.
be the spot where you're
Well, guess
hurting.
what they call that? They call that two things. One is they call it the silence network, where the body will choose what's the most important. If you're
Yeah,
running and a lion's chasing you and you sprain your ankle, you're not going to feel pain because the brain is choosing to save
right,
you. If you're running and you
right.
sprain your ankle and you're with your kids at the park, you're going to feel a lot of pain because that's what. So you can choose. And I
Right.
love telling the story about this construction worker. It's in all the research. He was on a construction site, and he put a nail through his boot, and he was freaking out. I mean, he was really freaking out in horrible pain, and no one could calm him down. They got, the first day they call the ambulance, they put him in the ambulance, they give him a shot. He is not responding to anything. He is screaming in pain, and they take him to the ER, and they cut open the boot, and the nail is between the toes.
Oh,
And
no.
that was his response, of like, I see that, I'm in
Yeah,
pain. Another
yeah.
story that they correlate the two stories, they're true stories. Guy's on a construction site and he's shooting nails, shooting nails, in a plank. And he feels something in his face, nothing's going on. A week later, he goes to the dentist because he's got some pain. And they find a nail piercing through his brain.
Oh,
He's not having
wow.
any pain. So we all experience pain, usually related to how we were brought up, what we saw in
Mhm.
the house. Sometimes we have more stress, less stress. We have something called, there's a report that's called adverse childhood experiences, ACEs. And sometimes we'll have things that happen as a child, and we will have a more sensitive reaction to pain, and we will be more liable to have pain or not, depending on our childhood. And so they've been
Mhm.
studying so they can help people understand who may be more susceptible. And so then we get to understand. I mean, my mother had a terrible disease growing up. So I have a horrible health anxiety, but I'm not in pain. I understand where I came from. And I
Oh,
channeled
yeah.
it, and I learned a lot, and I did a lot of therapy and a lot of work on myself. But I think all of us have health anxiety after COVID, of course,
Yeah.
but we don't have to live in chronic pain or
Right.
disease, even though
Right.
we might have a sensitivity to health, our own health. And anxiety is not a bad thing.
No.
Who has anxiety? I cross the street and I wait for that red light because I'm anxious about my body. It's not a bad thing. It's a protective, it's a sensitivity, it's like an alert. And
Mhm.
so we shouldn't see anxiety as a bad thing. It's a message. And this sometimes pain, and to our listeners, sometimes pain is saying something. So go deep inside and say, what is my body saying? So, Treva, what was your body saying over the years with all these things that were happening? And then the trigeminal nerve, what was your body saying to you?
I'm not sure. Maybe that I was on the wrong path in my life. Part of me thinks that I
I don't
was
think
a
any
lot of
path is
times,
wrong. I think
you
paths
know.
are just a big lesson. I don't think they're right or wrong. They're like,
Yeah,
you're on
we
a path, and
you're on a path, and maybe it's not the path you should be on, and maybe now I'm going to be on a different path.
well, you
That's what
already
I'm hoping.
are. But
I'm
you
hoping.
determined, God gives us the boat and the oars, and then he gives us the river, and then we've got to decide. And I think a lot of us don't really want to, we don't. It's a big responsibility to be a big girl.
Yeah, and it's it. I think you can get stuck a lot of times. You get stuck on one way, and maybe I'm just hard headed enough that it took this to get me to wake up.
That's that's the quality, the beautiful quality that, on the pendulum, sensitive, strong, stubborn, you took that quality and you put it in motion, and it uses it to serve you. You use that to serve you. And you were, that kind of patient. Every time you were in the hospital, you were, already planning on what was going to, like, so yeah, certain personalities get TMS and certain personalities will heal TMS. Everybody can heal from,
Everybody can
everybody
heal.
can heal.
Yeah.
But some of us will have these certain personalities. And so you learned a lot about yourself. Tell us a little bit more about some of the things you learned about yourself and your healing.
Um, I don't know. Like, I just know that I want to help people. I really always wanted to help people. And I didn't go down that path, for, different reasons, And now I think that I feel like I've been given a second chance,
Wow.
you know, and or third or fourth, just, you know, when you're in an ambulance and, and you hear the technician
Smiling. Yeah.
saying, her blood pressure's tanking, her blood pressure's tanking, and being on the phone with the hospital saying, what do we do? Her blood pressure won't stop going down, and you're in the hospital and they're saying her blood pressure's 25, and the doctors can't find your blood pressure because it's so low. But I never thought I'm dying. I never once occurred to me that I was going to die. I
Wow.
always thought, come on, figure it out.
Wow. Wow.
I'm getting over this. I'm getting
Wow.
over this. And
Wow.
so, I know there's something more, that I'm supposed to do.
Wow.
And I just want to do it.
That's chemical. That's
I
chemical, that
mean,
belief system. And I wonder if you just you didn't fear death. And I think a lot of people, they're so frightened of
no, I
death.
didn't.
They're so
Yeah,
frightened of the symptoms that they go into this fear mode, and they're in a real cycle. I
yeah,
think you just put the nail. You just really figured something out there.
yeah,
You didn't want to die, and you also weren't scared to die.
yeah, yeah.
Wow.
So it's hopefully, my hope is that somebody sees this and that this helps somebody
Wonderful.
and
Wonderful.
gets them going, like I did, realize they can do this. Your brain can cause you to be ill,
Yeah.
but it can also cause you to be well.
Yeah.
All you have to do is
That's
train that
it.
brain.
That's the Joe Dispenza work. He'll say that thoughts made you sick, but they can also make you well.
They can, they
And
can.
yeah. So let's just look at some of the questions that I answered a few of them, but um, Bharti said, I'm using somatic tracking. What else can I use? And we talked about journaling and meditation and exercising and knowledge and repetition and trust and belief. Anything you want to add to that?
Yeah, and believe that you just because you have something physically there doesn't mean you have to be in pain. Just because there's a physical, Dr. Sarno called them physical abnormalities, those are normal parts of aging. Those are normal parts. I mean, I believe there was a study done where most people in their 20s have some type of bone degeneration or, arthritis, but they don't even know it.
Yeah.
And that the majority of the people who have pain are people who are working, who have families, who have life happening that causes stress of one kind or another. It's their mind is capable of causing this pain, and hopefully they realize that, and they realize maybe I don't have to be in pain. Maybe I can, you know, heal. You don't have to heal physically, but you can heal emotionally and heal the pain.
Yeah, beautiful. Well said. And Caitlin asked, do you think this would work for autoimmune trigeminal neuralgia, trigeminal or neuralgia induced from lupus? And I feel 100%
Oh,
sure it
absolutely.
can do.
Absolutely. I believe it. I believe it would. I really do believe it would. There have been several autoimmune disorders. I believe you had an autoimmune disorder, someone who'd recovered from that on your channel already.
Mhm, mhm,
Um, so why not?
Yeah,
You
yeah,
know,
there's no question in my mind. And Aniko said endo here with trigeminal neuralgia. Did he mean like endometriosis? Does she mean endo here with trigeminal neuralgia? I think that might mean endometriosis, which has also been studied. It's
see,
I
I
mean,
had endometriosis really bad.
wow, wow,
Yeah,
yeah,
I
amazing. Yeah, I have a few
yeah,
broadcasts with people healing, and it absolutely is something that can be healed. And I've met people that have healed because we're talking about inflammation. And so many of these autoimmune conditions are the basis is inflammation. And we want
mhm,
to know what's causing the inflammation. And it's the brain, and that's where you go to heal it,
right.
where it starts. Um, and another person is saying, I can't help until I helped myself incubation period. Not sure what that means. But anyway, I am really happy to see some new people on the broadcast. So this broadcast will be it's live now. It's going to be recorded and sent to my YouTube channel where there's 266 broadcasts of people healing everything from A to Z. Doctors speaking. These doctors who are speaking, who are the ones that do recognize these neuroplastic conditions, that do recognize that
Yeah,
the autoimmune can be healed. In Unlearn Your Pain, the book from Howard Schubiner, Dr. Schubiner, he's mentioning a couple of dozen different conditions. There's a lot of resources and a lot of research. And, if your condition's not there, it doesn't mean you can't heal. These are just the more popular
right.
ones that are healing. But I've seen everything heal. I
Mhm.
really have. I've seen such unbelievable things. It's hard for me to not just be swinging a flag and saying everything.
I
Body heals, the body gets sick, the body gets well. The body knows the solution before the problem. Like it's been well. So
yeah,
why wouldn't it be able to go back there? It's not
right,
broken. It's not
right,
damaged. You were
right.
going to say something.
No, I didn't ask my friend if I could tell her story on here as well.
Okay, we don't
But
mention her name if you want to tell the story.
I'm
We won't
I'm
mention
not
her
going to
name.
tell the story, and
Okay.
I'm going to tell the story. I'm not going to mention her name,
Okay.
but I have a friend, a very good friend that I talked to. She had some issues going on with her throat.
Yeah.
She had lesions on her vocal cords. She could barely speak. And her and I were talking, and I asked her, think about what's going on in your life. She had some very stressful issues going on in her life. And once we, you know, discussed that it might be TMS and what the point, because she'd been to specialists, she'd been to different specialists, she'd taken all 12 different kinds of medication, nothing was working, nothing, and it was getting worse. Once we discussed the possibility that it could be TMS, and she started thinking about her emotions and what was going on in her life at that time, I mean, immediately she said, I feel like I've had, a big weight taken off my chest. 'I think you're right." And she, 'Cause, you know, I feel like I've had, a big weight taken off my chest. I think you're right. And she, 'Cause, you know, I feel like I've had, a big weight taken off my chest. I think you're right. And she, 'Cause, you know, I feel like I've had, a big weight taken off my chest. I think you're right. went back to the specialist, a month or so later, and the lesion on her right vocal cord was completely gone. The one on her left vocal cord was substantially improved with no more medical anything being done, only her recognizing that it was her emotions that was making her sick, and she was healed. I mean, it was a physical thing that was wrong with her, but it was caused from her brain. Her brain was trying to protect her from an issue she was having to deal with that was very emotional, and I mean, it works. It's not just trigeminal neuralgia. It's not just back pain. It's not just knee pain or carpal tunnel syndrome. It's not just these things. There are so many different things that are physically wrong with people that I am convinced are TMS, just from my experience and from what I've seen.
Well,
I mean, my experience was a big one too.
exactly.
I tell you,
And look, you're. I'm going to say on the record. I mean, you're constant getting meningitis, and you're constant spinal leak, like your body's inability to heal that spinal leak, even after surgery, was something deeper going on.
Yeah.
So I'm just looking at looking at the the information, and you are really quite an inspiration, and I'm so grateful.
Thank you.
And
Thank
I'm
you.
happy to meet some of the new people that are in the studio. And if they have any questions, you're on Facebook. They can find your name. They can ask you. They can ask on the recording. They can reach out to me. They can have a complimentary consultation. You want to join into the complimentary consultation and talk with us? I do that with some of my guests because people want to speak to you personally, and I want to be a bridge to help people as well.
Yes, that would be great. I would
Yeah.
be very willing to talk to anybody. I mean, like you said, I felt like when this happened, when I got rid of the pain, I wanted to just scream from the rooftops, at everybody that was in chronic pain. You can
Amazing.
heal. You can heal.
Yeah.
Trust
Amazing.
me.
Yeah. Well,
And
Treva, I'm saying your name right? Treva,
yes,
such a beautiful
yes.
name.
Thank you.
I'm sure I know you'll live a long life, and you'll be able to help a lot of people, because it's even just here tonight, and we met a few weeks ago, and it's the first time I've had someone on my program who's healed this. So I'm really blessed to open up this chapter for this particular condition, even though we say it's not so much about the condition, it's about the relationship between you and your body. And this happens to be the condition. And I believe everything can heal, and people can benefit from these methods, these neuroplastic and mind-body methods. And, these physio-psychological disorders, or these stress illness disorders, there's another name, we call them medically unexplained symptoms. I mean, the doctors are doing the best they can, but we don't need to put a Band-Aid on a problem when we can get to the root cause.
They're treating the symptom, not the cause.
That's it.
Not the source.
Right.
Find the source.
That's it. That's it. And so I am just grateful that you blessed my studio. I'm grateful for the internet. I'm grateful to be
thank you very much.
across the globe and speak with you. And so thank you again. Thank you for your inspiration, your resources, your intelligence, your bravery, your courage. And to all of you listening, we're just giving it to you. We're here to support you through this process. We know you can do it. And it's a new year.
Yes.
Okay. So blessings to you in the new year, to you and your family. Thank you, beautiful soul. And we'll meet again soon. Have a wonderful day.
Look forward to it. Thank you.
Bye, dear. Okay, 1 second. It's going to go off.